Boris Johnson, overnight, yes, he's now made it very clear that July the 19th may well be a day of freedom, but there will still be some restrictions in place. This idea that Sajid Javid seemed to allude to, that everything's going to be absolutely fine, we're going to do that as quickly as possible, doesn't seem to be the case. But from a medical point of view, Amir, I suppose now it gets to that point to go, OK, which restrictions would need to stay in place, do you think, in about 2 to 3 weeks' time to keep us as safe as possible? And which ones can we go, you know what, OK, that's OK now? Have you got an idea in that at all on that?
Yes, so he has made all the right noises in terms of July the 19th. He's going to ease a lot of the restrictions, but it sounds like mask wearing, particularly in indoor spaces, on public transport, that kind of thing, will remain in place, or at least be advised.
It's really worrying, because I don't know anybody else. I was on the tube in London yesterday, and I've noticed less and less people wearing the mask. So if that's going to be a restriction in place, they're going to, I think, increase that campaign again and remind people.
I think that's going to have to be the case. When we're pushing for the easing of restrictions, when they're saying like all of these things can be lifted, there just has to be a firm line about what is being left behind, because otherwise people will just think it's fine, it's all gone away. And we've got to be very clear that cases are rising. Scotland's recording record numbers as we speak.
And just on the point that Jackie made there as well about holidays to Europe, Boris Johnson's sort of seeming to say that he's very hopeful that those that are double jabbed will be able to, maybe Angela Merkel will offer an olive branch and look at that. But somewhat worrying, the Indian AstraZeneca jab. Do you remember how we first started talking about this, didn't we? When there was a hold-up in supplies coming from India, maybe partly because they knew what was heading their way so catastrophically in their own country. But that actually could prevent people from travelling. So if you happen to have had the Indian AstraZeneca jab, which has still not been approved officially, and 5 million Britons have had that, it might be that you can't, because it's not recognised, count it as a double jab. Now, I guess there's two questions here. One, the fact that it hasn't been approved, should we be concerned that that means it's not as effective, or is it just admin? And secondly, terribly unfair.
Yeah, terribly unfair. This is a story based on a technicality, essentially. So the AstraZeneca vaccine, some of it was made in Europe, and batches of it were made over in India by the Serum Institute of India, as you say. They're both exactly the same vaccine. They're both as effective as each other. So the issue is the Serum Institute of India haven't applied for a licence with the EMA, the European Medicines Agency, whereas the European version has. And that's where the technicality lies.
But it could have a big impact. I
don't think it will come to that, to be honest.
You don't think it will?
No, many countries have already said that they will allow people who have been vaccinated with the AZ vaccine that has been manufactured in India into their countries. Essentially, it comes down to the European COVID certificate, which does record which batch numbers you've had of the vaccine, which can identify where they were manufactured. But it's a technicality. It's not based on science. I don't think it will be a big issue, to be honest.
So we're all very worried, aren't we, about getting to see our GP and numbers of GPs. A news story that just seen in the last hour or so, and I know you've been across it, that senior doctors in England are going to be consulted on taking industrial action if the government's 1% pay rise offer is not improved. We're going to see doctors going on strike.
Well, this is coming from the BMA. They're going to consult with some of their senior doctors, the consultants. It's hospital doctors we're talking about here. Bearing in mind, according to their surveys, 40% of senior doctors are suffering from anxiety, depression, burnout, all as a result of the pandemic and the worry of these huge waiting lists that we've got. And we are committed to clearing that backlog. But we've got to be honest here, that 1% pay rise proposed by the government is a complete insult. It really is. It's a kick in the teeth, however you look at it.
And would that affect, because we heard a lot about how it will affect care workers and nurses, and that affects doctors too?
Hospital doctors. It doesn't affect
not
GPs.
because they have a separate contract,
yes.
But hospital doctors.
It does.
Well, yes, that is going to be a kick at it. And are they, do you feel, genuinely angry about it?
Yes, very much so. So they want a pay rise that's closer to 4%. The Royal College of Nurses have already expressed their anger with it. They want a pay rise closer to 12.5%, and they're going to consult with their members around industrial action as well. what we've got to be really clear on, this isn't a case of, the argument is often, well, if doctors and nurses are getting a pay rise, why aren't teachers? Why are other departments? But that just sows division. That's how people get away with a 1% pay rise. It's not a case of why they're not getting a pay rise. It's why aren't they getting a pay rise? Why shouldn't they get a pay rise? They've worked incredibly hard. And this industrial action will only affect overtime, so paid and unpaid overtime by these senior consultants. But that is really important to clearing that backlog in the NHS.